Good afternoon, everybody. This is Dana B with my buddy Clint Carter out there in Utah, and I am from Mountain Patriots Educational Ministries. A lot of you know exactly who we are, especially here in Virginia and in Frederick County. And as you know, the Mountain Patriots have been trying to do everything that we possibly can to help the community. We go out there, we do food drives, we do training, we do radios, we do all kinds of holistic health care and so forth, and make sure that people have a grasp of what's going on. But today we're going to talk a little bit about healthcare because that seems to be the 800-pound gorilla in the room. But before we get started, Clint and I get started, just wanted to touch a little bit on Mountain Patriots. If you're not used to us or you haven't been on one of our podcasts before, this is our homepage, Mountain Patriots. MTNPATS.com. Our email's at the top, which is mtpatriots@proton.me. And I did want to share something with everybody before we start. We are a group of people that support safety and security for our neighbors in Frederick County. That's what Mountain Patriots is here. And our mission is to build a caring, freedom loving, compassionate cadre of citizens with patriotic and positive attitudes and a willingness to share their time, effort, and sacred honor. And the reason I bring that up is because we are growing and we're looking for some more people to be willing to jump in here with us and help us, not just here in Virginia, but spread to the other states that we're working on. One of the things that we are doing is trying to celebrate our 250th anniversary of the signing of the Declaration of Independence. And to us, that's a huge deal. So if you come to our website, we're looking for some people to sign up for our podcast. And our podcast is pretty simple. What we ask you to do is just put in your name, phone number, and what character you'd like to portray. And you're going, what do you mean? What character, Dana? Well, Mountain Patriots Educational Ministries is doing the educational podcasts of Make America Patriotic Again. And the neat thing, like Clint will tell you also, he could be out there and be a patriot in Utah or Nebraska or California. Wherever you're from, you can join us in this 250th anniversary celebration. Here's the chance to be a part of history, folks. We seriously need kids, moms, dads, teachers, business owners, history buffs to bring our historical figures to life and to share this everywhere about the 250th anniversary. And we want you to be a part of a time machine. So if you'd like to dress up as George Washington or Paul Revere or Harriet Tubman or Eleanor Roosevelt, we actually have Dolly Madison coming on here, which ought to be a lot of fun, as well as Amelia Earhart, and be that character where we can interview that character in the time machine. So we ask you to sign up at our mtpatriots@proton.me. You can contact us, step back in time, and help us relive the history like never before. So that's our little spiel on what's going on as far as Mountain Patriots is concerned. And I'm going to turn it over to Clint because he and I have done a lot of working with accountants, brokers, enrolled agents, planners, the BUCAs, Blue Cross, United, Cigna, Aetna, pharmacy benefit managers, all the compliance from flexible spending accounts to HRAs, individual coverage, HRAs, family medical leave, HIPAA, you name it. We've got a background between us of about 50 years doing this. So we've been talking a lot about what's coming up on the 31st of January. And when we start to talk about healthcare, and we have these conversations all the time. So Clint, I'm going to turn it over to you and talk a little bit about what you've been watching on the ACA and what people need to be aware of as we flip the calendar to 2026. Thanks for being here, brother.
Hey, it's really good to be with you, Dana. Before I get into the ACA, I just want to put a plug in for Dana and the fact that he wants to debunk the 1619 project and actually bring true history of the United States back of 1776. So Dana, I'm very pleased to see that you're doing that. And I hope there's a lot of people that understand how important that is that we teach our children.
Oh, you're talking the 1607 Port Henry. I got you. That's coming up. That's coming
Okay.
up. We hope to have President Trump there for the 1607 project in April of 2027. Thanks for
Yeah.
reminding me about that.
Yeah. And I think when I say we need to debunk the 1619 project and the false characterization that, quite frankly, big education wants to do and manipulate our children into thinking that our country is nothing more than a colonizer. We're not. We're
No.
freedom, independent, loving people who want to live the covenant of this land. And as free men, we need to be able to do that, Dana, and we need to talk about uh, the Savior in that regards and the covenant that
Amen.
we have with Him in this land. So I just wanted to bring that up real quick. I thought that was important. I love the fact that you're going to be out there getting people to help. And quite frankly, this takes us to the ACA and the way that the ACA has taken freedom away from us, Dana.
Absolutely. And
I
we've
just,
watched a lot of things on this and had a lot of conversations, Clint. You know, you were talking the other day about Marino and Congress and a lot of the lies that we've been fed. You want to go back to 2010, where it all started?
yeah, in 2010, when all this was starting to come out, and Mr. Obama said that we would get $2,500 reduction in our premiums, we could keep our doctors, keep our plans, and then we'd all be happy. Well, that's quite frankly been a big lie. And Senator Marino actually brought that out very well in the last congressional hearing that they had with the senators before they vote on the health care bill that's going to, they want to extend the subsidies. Quite frankly, Dana, when you look at this, one of the things Senator Marino brought out, and I'm very grateful that he did, is he asked a very good question. Do these subsidies affect unions? The answer is no, because the unions have their plans. Does the subsidy affect business owners? The answer is, or businesses who offer benefits to their employees? The answer is no, because they don't get subsidies. This whole thing has been a lie from the beginning and been nothing more than something that they wanted to fail so that they could move us directly to a one care healthcare system so that they can control everything. Once they control healthcare, they control everything that you and I can do. And that scares me because we already saw that. And what everybody wants to say, the pandemic, but I'm going to call it the plandemic because they wanted to
Was
see how far they could push us. This was bad. And I will tell you, if
this
we
is really
continue
bad.
down that road, Dana, we are in serious, serious jeopardy. Because right now, let me give you an example. Ford Motor Company is a $56 billion company, as an
Right.
example. In 2010, one of the things Senator Marino brought out is in 2010, United Healthcare was a $106.6 billion company.
I think the shares were also like $165 a share or something along those lines, if my memory
That is
serves me.
correct. So those shares were like $165 per share. They're now over $610 a share, and they're now a $600 billion company since 2010. The reason for that, Dana, is because of all of the lies and the heavy subsidies that we, the taxpayers, have put into this because the federal government's subsidizing big healthcare
Right.
industry as far as the bukas are concerned. So they don't care if prices go up. Matter of fact, they want prices to go up because if prices go up, that means they're making more money. Because one of the things that you and I discussed the last time we were on, and
Mm-hmm.
this is what people don't understand. There's an 85-15 rule and an 80-20 rule that's designed right inside the ACA. That affects the big
All
insurance industry.
businesses and
The
large
but
businesses.
Yeah, so it's 85-15 for large business owners, which is 100 or more, and from 50 to 100 is an 80-20, meaning that the carrier only gets to keep 15% of the premium that they collect, or 20% depending on
Of
what the
what they
size of the
paid out,
company is.
any profit that they've got, okay, that they make on 100 or greater, they get to keep 15%. If it's under that number, they get to keep 20%. So they're looking at it and saying, well, let me see, we're making 15% of a bill that costs $100. We're not making any money. Why don't we just move it to $1,000? The government's going to cover us anyway. And we can make the money and we can stick the hands in the American's pocket and they're not going to know what it is.
Why?
Exactly.
Yeah.
Have you ever bought a car without
Hey,
looking at the sticker price? I mean, they do it all the time when you go into a doctor's office. How much is that
well,
procedure going to cost? Oh, $30 copay. Okay.
so Dana, to your point, would you go fly somewhere and have them bill you afterwards, or would you want another price before you get on the plane?
Exactly.
Medical care is the only thing that we have that we do not know the price before we walk in the door,
Right.
because one of the things that they educated us on, even before ACA happened, I can remember this as a young father walking into the doctor's office and asking, how much is this going to cost? And they would look
Right.
at me, and this is the doctor's office, the billing department, saying, well, do you have insurance? Yes, I do. Well, then don't worry about it. Your insurance company will take care of it.
And you're like,
So they were
okay, so you
hiding.
hand it like a credit card.
Yeah, they were hiding the price long before we ever started, because they knew that they would incrementally raise it. Because when there's insurance that pays for it, who gives a damn? I hate to say it that way, because that's how we look at it. Because don't worry about it, insurance has got it. Well, that was the biggest mistake of our lives, because we could not hold anybody accountable, and they could raise the price wherever they wanted. Now, I need to bring out this fact. Carriers got wise to that, because there was an appendectomy that happened in the 1970s that cost an insurance company $1 million, because they didn't have the clause usual and customary charges. So now they have a clause called usual and customary charges, which means that a
Usual and
carrier
customary.
cannot charge over the budget of what usual and customary is. You have to understand that. That was the first time that there was a regulation by carriers to impede escalating costs that they could just willy-nilly throw out there, because in the old days it used to be whatever the charge was, it was 100% paid. Well, they don't do that anymore. That's an important factor. Well, that brings us to the 85-15 rule and the 80-20 rule, because they learned how to skirt that, because the only side they capped was the insurance carriers. Well, the insurance carriers say, okay, that's great. Well, what if prices go up? They don't care, because what Dana just brought out, do we make 15% on $100, or do we make 15% on $1,000?
Exactly right.
And when you look at it in that fashion, or 20% on 100, or 20% on 1,000, of course they want the bigger number. So they don't care if prices go up. And that's what we've seen. So you've also seen, Dana, to your point, the PBMs that are setting
Pharmacy
out
benefit
there,
managers, PBM folks, pharmacy benefit managers.
the pharmacy benefit managers don't care what the drug costs. Matter of fact, they want them to go up. That's why when you see these advertisements on TV, ask your doctor about these newest, latest drugs. Well, guess what? Most of those fall in a tier 4 or tier 3 drug thing, because somebody has to pay the R&D on it,
Right.
the research and development.
Right.
Well, President Trump, I love what he's doing, and I'm gonna throw this out. The fact that he said, and Senator Reno brought this out, that we have to get the same pricing as favored nation status that all these other countries get, because they get our drugs that we get here in the United States for sometimes from anywhere from 100 to 15,000% less than what we pay, because we, the Americans, pay for it in our taxes, and we pay for it in our insurance premiums going up. That's the ridiculous part about this. We should never pay more than what you can go. Example: you want to get a diabetic medication, go to England and get it over there, because you can get 6 months worth of it for 2/3 of the cost that you can
And if
buy
you have the
one month
money, you
here.
can take a vacation on the difference that you'd pay here.
Exactly. How sad is that? And that's just one side. I mean, think about all of these drugs. Big pharma is a blight on the American people, and I mean what I just said. They put band-aids on things. They never want you to become whole, or they never want you to become healthy,
Exactly right.
because that means that you're going to be taking their medications the rest of your life, and whatever length of time that is, you've got it. Metformin, as an example, is one of the worst drugs you can take.
And Ozempic,
And Ozempic is the same way, because what it's
it'll
doing
kill
is
you.
it's doing things to you that you have no idea. That takes us back, quite frankly, to what happened in the pandemic. And I said this earlier. Most people want to say pandemic, but I'll say it was the pandemic, because they wanted to see how far they could push us. They pushed us to a point where we had to take vaccines. Well, guess what? There's now evidence coming out, Dana, big time evidence, that it's caused major heart problems. It's causing more cancer. All of these things are being documented. And of course, they passed a bill with Big Pharma that nobody could sue them because it was mandatory. We just had to get rid of that awful COVID. Well, guess what? COVID was nothing more in some cases than common cold. Now, I don't want to make light of it because I know there were people who died from it, who had got
And it's a
complications that were
shame.
serious, but that
It's a
was a
shame.
small percentage of everybody that had it.
Clint, I'm gonna add this, and a lot of people don't know what this stands for, because I know I followed this from the very beginning. You know, with Peter Daszak and Dr. Fauci in the Wuhan lab, and the 32 biolabs, and then you get into Russia and what they were doing. But COVID, COVID 19. If you look at that word, it stands for Certificate of Vaccination ID 19, 2019. And the whole idea was that now you're into the New World Order and the World Economic Forum and control, control, control. And they control us by the food, the air, the geoengineering, all the stuff that's happening to us right now. But we could go on and on and on about what they're doing to us. But what Clint and I wanted to do is lay the groundwork here a little bit for some ideas that we have and we use ourselves in order to not have to pay to get good, clean, better health care, not death care. Okay. I think of it as death care because they keep you alive long enough until they take your stuff. I'm watching a friend of mine's mother go through this right now. She's in a nursing home and they're going to take her house and her car and her bank accounts and everything. I mean, come on. Okay. That stuff should be, you know, left for the kids and so forth. But that's how badly that this thing got screwed up. And I'm going to share something with somebody that Barbara and I use. Now, if you're not interested in saving any money and getting better health care, okay, turn this off. Okay. If you're not interested in something, a different idea outside, but we don't even have a box. Okay. If you're not interested, turn this off. Okay. If you're interested, I'm going to share this with you. This is one of my companies right here. And let me go to this real quick. We have a program called Patriots On Call. Okay. This is virtual medical and mental health care. Mental health is huge. And I hate to say this, but look at Rob Reiner and his son the other day. I mean, this is all mental health. Okay. People flip out for all kinds of different reasons right now, but there is mental health. It is the largest growing part of the medical field is mental health. So people spend billions and billions of dollars on mental health. What we have is a program. The first one is called the virtual care program. There's one called virtual primary care. And what this allows people to do is get a consultation for $20 from a doctor, certified doctor, not an LPN, not a nurse practitioner. The way it works is when I signed up for this, I get the same doctor. The same doctor. So I had that doctor patient relationship that I lost over Obamacare. My doctor was able to see me for 6 minutes. So, in the essence of time here, this gives me an opportunity, Barbara and I, to and this is what they do with your health insurance anyway. A lot of them will say, "Oh, you don't have to come to the office. We'll do this virtually." Why am I doing that? And then I pay 30 or 40 or whatever it is towards my deductible to get that care. So I get to sit in my house, available in all 50 states in Puerto Rico. Barbara and I get once a year our lab panel and blood test. Okay. I get free or discounted prescriptions. There are 37 medications that we offer. We just went through this the other day with amoxicillin. We get amoxicillin for free. It's all part of the premium. That's how much they've overcharged us for medications. I have a friend of mine that was on this plan as well. Used to have to go to the doctor every 3 months because he has high blood pressure. With this program, Medicare was $10 for his prescription, which was $30 over 3 months. And then he had to go in every 3 months. This doctor looked at his medical reports and everything else because you have your own doctor. you have your own doctor now, and says, I mean, you've been taking the same medication. We'll get your lab work done. We'll get this done at at LabCorp or Quest. And he says, oh, you're fine. What I'm going to do is I'm going to make sure you got your blood pressure medicine. I'll catch you in 6 months. Goes to the pharmacy. Guess how much the cost was for the blood pressure medicine, Clint? Zero,
Zero.
because it was all covered in it. So even if you have health insurance, this is a great program. So there are 37 medications with a zero copay, and there are over 200 chronic medications for $5 each. And this is right on my phone. Okay, so I also have telemedicine. Something happens to me, I don't feel good, I call, I get the doctor on the phone. Now, here's the neat thing about this. Again, I'm talking to an MD. It works anywhere in the United States. So I'm talking to my doctor, and if they can't treat me and they think that there's something wrong, they will send me to the emergency room. The last time I was in the emergency room, it was $1,587. $857 was sitting in the emergency room for the room and board of watching CNN on television. So I had to pay to watch CNN. So this whole package comes with my own primary doctor. It comes with 200 chronic medical medications at $5 each, 37 with at zero, and mental health. I can choose from an array of different doctors on the website in my area for mental health. If I need a psychiatrist, it's a $200 setup and $150 per session, and the same thing for a psychologist. So we can actually do mental health here on this platform. Now, how much does that save you in time? How much does it save you in gas? Here's another piece. If you're an employer and you run a place like Jiffy Lube, if one of your bays is closed, how much money do you make? You don't make any. So if one of my employees is sick, I can always say, hey, look, during your lunch hour, our company paid for it for you, or you can take it out of their check, and you'll be able to go into the lunchroom or wherever you need to go in your car, call a doctor, go get your prescription. The last time I used this, it took 8 minutes for the doctor to call me back. And for me, it's a 30-minute trip to the CVS. So I had everything done, including the azithromycin for my eye, in a little less than 2 hours. That's the phone call, that's the prescription, that's picking it up and being home. Now, how much money would an employer save by doing that? Now, that is what we call virtual primary care. Then there's what's called, another piece to this is care navigation. How many times have you gotten a bill? Okay, Clint, you know what I mean? And they don't read the ICD-10 codes correctly, never sign in the office, oh yeah, I got the $30 copay. They can say, we're going to give you the vaccine. You've given them unlimited, make them print it off. But if you get a bill, make sure that you turn that bill into us at Patriots On Call. And we have a healthcare navigator an advocate that will work on that bill for you. We just had a young lady with an $8,000 bill. By the time they figured out everything that we needed to figure out on our end and through the hospital's end, not only had the lady already covered everything with her deductible, but the next 6 months until her renewal came up were already covered. So she saved $8,000 by having this $70 a month plan. So you get primary wellness. I like this. You can select and keep your own physician, virtual wellness visits and minutes, lab work, discounted prescriptions, urgent care. And here's the neat thing about it, Clint. One of the neatest things about this program is it's in your pocket. So no matter where you go, anytime, 24/7, and it covers you and your spouse for the blood work, okay? But for the urgent care, it covers another 6 members of your family. So anybody can use the telemedicine app. And I have had absolutely nothing but success with this. This paid for it the first 2 months I had it, and I've had it for the last 5 years. No germ-filled waiting rooms. I mean, you can get it for an individual, you can get it for a family, but it's $49.76 for an individual. For the family, it's $64.76. If you're a Mountain Patriot, you save $5. And then our virtual urgent care is $17.76. Pretty cool number. It's actually supposed to be $19.95. I couldn't see that. I didn't want people, they need the money. So we lowered it to $17.76, zero consultation for the doctor. So I'm gonna stick with that, and I'm gonna flip over to the next piece, Clint, and I'm gonna let you cover what we're also doing for your doctor network. That is your virtual urgent care that'll save you and your family a fortune. This is what Clint and I are working on right now across the United States. There's a lot of companies, a lot of health shares that are out there, and they're actually blowing the BUCAs. BUCA stands for Blue Cross, United, Cigna, Aetna, Kaiser. Go do some research. Ask Grok how much they rip you off. Okay. And it will actually tell you. So I'll have Clint take us through this part on how he and I can help you with impact. All yours, my friend.
Thank you so much, Dana. That was a great explanation. And by the way, I think that's very critical to care,
They
is
go
knowing that
together.
you can have everything that you need right there at the touch of your phone, and a screen like this where you can see a doctor, they can get to know you and have a relationship. And by the way, what Dana brought up, and I do want to touch on that before we get to impact, Dana, the fact that Dana said that they have a advocacy to make sure you're not paying more than you should.
It's huge.
I'm going to say this, and I say this to everybody I know: never pay a medical bill that you get directly from the hospital or the doctor until you see what's called an explanation of benefits.
EOB.
EOB.
And I don't know if you can see this, but that is my app. And I can see a doctor, recent prescriptions, call my doctor, urgent care, call now. Here's another thing that we had happen to us. I don't mean to take it off track, but this was a cool situation. And you know this guy, you know his son. He's a good friend of ours. I'm not going to bring up a name, that's HIPAA stuff. His son is a truck driver. He's in Nebraska. Okay. He's got to get back to South Dakota. He's got some kind of infection on his inner thigh. Okay. And he's going, Dad, this is really bugging me. I don't get home for another couple days. I don't, I don't, where am I going to find a doctor out here? Okay. I don't know if I'm in network. He goes, no problem. We called Patriots On Call, got it set up for $17.76. It took us 30 minutes to get that person onboarded. Called back and said, okay, call. This was so cool. He calls. The doctor says, well, pull over. Let me see what you got. Well, since it's video, he showed him his leg. He goes, oh my gosh, man, I am so glad you called. That would have turned into a staph infection if you hadn't gotten that treated in the next 24 hours or so. But this is what we're going to do. We're going to get you the right medication. He says, can I stay on the road? Yes, you're going to be fine. You're going to have to bandage it, but you're going to be able to take this medication, get rid of the infection. And he says, Doc, but I'm out here in Nebraska. My pharmacy is back in South Dakota. The doctor says, no problem. I'll flip you back over to customer service. Customer service gets on. This is so cool. She says, well, where are you, sir? And he tells her, he goes, I'm at mile marker 314 on Route 40 or whatever it was. I can't remember the route. And she
I-80.
said, huh?
I-80.
I-80. And she says, well, that's not a problem, sir. We can get you a pharmacy. And he says, well, I have another problem. I'm a truck driver. She says, that's not a problem. We'll call a Walmart. That way you can pull into the Walmart and you can get your prescription. So from the time we got the phone call, set it up, got the doctor on the phone, okay, the neat thing about it is the advocate on the customer service representative, Clint, told him where to go. What you're going to do is you're going to go up 3 exits, make a right answer. She says, I can tell you exactly where you are and where this is. So the whole thing, you're going to die when I tell you this, including getting the medication, was less than 2 hours. Less than 2 hours. For me to go to my doctor is 30 minutes. For me to get home is 30 minutes. For me to get my prescriptions, another 30 minutes. Plus the $30 copay, plus being out of the office, plus. So, folks, if you own a business, this is one of the best things. This is one of the best Christmas presents you can give any one of your employees. It really is.
Yeah.
But
And
then we get into bigger things where we can't solve it. We can solve about 75% of those things that happen. But then we
that,
get into bigger things that
yeah,
cost people a fortune.
yeah, you can absolutely solve a lot of this by what Dana has talked about. The issue that you will have is the catastrophic care, or
What do you
the
do?
impact that you're going to have if you have a
Right.
broken bone, or if you have a you know, dislocated knee, or you have an appendectomy, or you have a heart problem that's going to require a stent, or any of those type of things. That's where you have to have catastrophic coverage that sets over the top of that.
Right.
That's where a company like Impact comes into play, and they are a health sharing plan. I will tell you, in my research, and I've done a lot of it, I will consider them to be one of the very best health sharing plans possible, because they will be able to be much like what everybody's used to, where you get a claim card, or a card that you hand to the doctor or the hospital, and it's bill to bill. Now, let me explain what that means. Most health share plans, you have to pay out of your own pocket, then submit the bill, and then wait to be reimbursed.
Right.
In this situation with Impact, and the reason why I like them so much, is you hand them the card, and they have a special platform that they've developed unique to them, that makes it so that you hand them the card, and the IBCT 10 codes that are needed to be there, they can code it, get it done right, and they pay the doctor or hospital within 15 to 20 days of receiving that. Not only that, but they handle the billing. They will negotiate according to what's necessary, and carriers do the same thing. Just so you all know, they pay so much over what Medicare pays. Well, Impact does the same thing, but they're very good at where they're at, and they will be solid in getting that done correctly, to the point that you will pay less this way than you would through the Buca plans. Example, we had a gentleman on a Sunday afternoon. He was out delivering some flyers. He was on a skateboard. He was 60 years old, it's actually 62.
That would be
He,
me.
he fell and broke his elbow. Okay.
Right.
And I mean, when I say broke his elbow, he shattered it.
I did the wrist.
Okay.
But yeah.
And let me tell you what happened in that situation. They wanted to put him in the hospital that day and perform surgery the next morning. And that surgery would have been $60,000. Okay. We told him to hold on, because we had a program in play for him at this point, that if they would let us do what we needed to. Guess what they brought that surgery down to, Dana? 20,000. Because they were able to get the real price. And that's what people don't tell you. And that's one of the things that Senator Romino brought up, and other people have brought up. You know what? If I go in and say I want to pay cash, what's the cash price? Well, it's $250. Well, if I have insurance, what is it? Well, it's $5,000 with insurance. So that's the ugly secret right there, is you're being billed according to what they want to bill the insurance carrier, and that's what makes prices go up. So let me talk a little bit more about Impact here. The fact that they take care of the billing for us and do all of that becomes very important. You no longer have to be the front line of figuring out how you're going to pay a medical bill. Impact's going to take care of that. I will tell you straight up right now, and I'm going to give you a perfect example. My wife, because I'm 66, I'm now on Medicare. Okay. But my wife, to keep her on an insurance plan for her would be over $900 a month to be on a Buca plan that would have had a $5,000 deductible to it.
Mm-hmm.
And then it would had another 90/10 to another $1,000. So there's
Clint, is that ACA or through the company?
One more time, I'm sorry.
Was that ACA or through her company?
Well, that was through her company, by the way.
So you can see where that's that 80-20 rule again, 85-15 program, where they make, and that's why your wife's program is so expensive. As an employee, I can't imagine spending $900 a month out of pocket for my
Well,
health insurance.
okay, so let's talk about that even for the small business owner that may be listening. You know what? If you have 20 or less employees, you don't have to offer the Buca plans. You could offer
Exactly.
something of this nature and actually cut your costs for your employees and get them the same care. And by the way, one of the things that Dana brought up that I thought was very important is the fact that all of these plans through the Bucas have a in-network and out-of-network deductible. So you could possibly pay two deductibles if you're not careful.
Right.
Okay, and people don't understand that. And it's the out of network deductible is higher than the in network deductible, by the way. So you talk about having major expenses. And by the way, let me just say this: you could go have a surgery, and the surgeon's in network, but the anesthesiologist is not in network. Guess what? You're going to have two deductibles that you just hit right there, because the
Yep.
anesthesiologist is not in network. So it's extremely important before you have that surgery, you go in and talk to the anesthesiologist and say, are you going to bill me as if I'm in network, or are you going to stay out of network? Because that might determine on which facility you go to. Okay. Dana's bringing up some things that are very good as far as advertising goes. We have all kinds of ways that we can help you with this. You can call Dana or I, and we can take you through this and show you exactly what it is.
I
But
love this
I'm going to tell
program.
you what, this program is as good as any carrier that I would put you through. For Christy, who is on this plan that I was telling you, quite frankly, we pay right at $357 a month as opposed to $900 a month. Which way do you think I want to go for coverage? And I'm going to have
Absolutely.
catastrophic coverage for anything that she needs as well. Just so you know, this includes, just like any carrier does, it covers your wellness visits, the things that you need to have. So it's comprehensive coverage in that regards. Now it is a health share plan, so they'll tell you they don't guarantee payment. But let me let you understand something. Carriers don't guarantee the payment either, and they deny claims all of the time. My son, as an example,
They'll turn it down.
they'll turn it down or they'll deny it. Let me
That's
give
what
you an
I'm saying.
example.
They'll turn it down and deny it. My son does all the medical billing for one of the largest hospital systems in the country, and he says, he says you can't fix this.
Yeah, you can't. I mean, my son, his firstborn, uh, had a situation where her water, my daughter-in-law's water broke early. I'm just not going to share names at this point. Broke early. We live in a little mountain town in Heber City, Utah at this point. As you can see, Mountain Patriots really work because you see the beautiful mountains of Utah behind me here.
Yep.
But the bottom line is what you have to understand in this situation is they didn't have a NICU at the hospital here in Heber. They had the life flighter to a hospital across the Wasatch Front, and Garrett said, I could drive and get her there just as quick. Well, it's winter time, so in the winter you're worried about icy roads and avalanches. So they said, we don't recommend that you do that. We need to life flight her to where there's a NICU because this baby's coming early. That life flight was $20,000. Because of the way it got coded, their insurance denied it.
Of course.
And so they've still been fighting to get that stupid $20,000 covered because the doctor in the hospital said, we will not help you unless we life flight her. Well, that's because if they don't code it correctly, they're going to deny it. So don't think your carrier is going to pay everything just because you got a carrier is what I'm trying to get at. So my point is, health sharing plans are going to become a bigger part. And I love the fact that Dana brought this up earlier.
They're huge right now.
With what President Trump did instead of what President Obama did, who made our costs go so skyrocketed high, it's ridiculous. President Trump's coming back out and saying, look, instead of paying all these subsidies to the carriers to the tune of billions of dollars, where we take a company like United Healthcare from $106 billion to a $600 billion company, and from stock that went from $161 to over $600
Exactly
in
right.
stock. Why don't we take that money and put it back to the American people and let them decide where they want to get their health care from? This is what we're talking about. When we bring the costs back where we know what the costs are before we
We
walk
the
in the door,
people
we the
control
people
our health
take
plan.
control. And by the way, if we think that we want to live on subsidies and live on the government, we're out of our minds, because
Yeah,
they can do whatever the hell they want, Dana. And I'm sorry I said it that way, but that's the reality. We
yeah.
have to start taking control back. If we want freedom, we've got to take it back. And that's what this is
And this
about.
is just one of them, Clint. Remember, COVID certificate of vaccination ID. You can't buy or sell unless you have this. So there's a lot of things that are going on, and you're seeing that in a lot of different countries. But let me go back here real quick in the essence of time. When people do this, a lot of companies right now. One of my best friend was over here the other day, and he says, "I just got my bill. It's $997 a month. My
Yeah.
deductible is $7,500."
Yeah.
He says, "By the time I pay that, that's $20,000. I'm not doing this stuff anymore. And if I go to the hospital, they got to treat me. They have to do. Am I now? Am I going to take that risk? No. I mean, I'm going to have something. Okay, but this is the way to do it. But I will say this: if we're looking more now instead of big pharma and the bukas and a lot of things, AI. There's a lot of really great stuff that is coming out, folks, especially in medical. But I can take instead of a deductible, we have a primary responsibility amount. Okay. If I had a health plan with a $2,500 deductible, I'm paying $25,000 a year to try to get that kind of deductible. And I got to be really, really sick to even get close to spending that. But if I have a $2,500 primary responsibility amount, what can I do holistically, Clint, with a
Yep.
$2,500 or $5,000 primary responsibility amount, where you
Okay, so
can't
let's
do it
let's
with your
take a look at it
regular
real quick.
health care?
First off, Dana, I'm glad you brought the pricing up. So let's just do this. Let's take a family of 3+.
Okay.
Okay, and we're gonna make them a 40-year-old person. So I don't care. Put 06, 06, and put 19. What is that? 84.
Let's go January, since we're coming up on it. Uh,
Just put January 1st. It doesn't matter.
January 1st.
And put
And what
19.
year do you want it?
Put 1984.
Okay, George Orwell. I mean, hey, I mean, let's get realistic, folks. We're really close to it, and we're trying our best off with Mountain Patriots to give information. I don't care if you buy this. What I
Yeah.
do care about is giving people the information so that they can make at least a logical,
Okay, so
rational
let's
decision
do
that can
this. Let's
help.
do this one at a time so they can see the pricing. As an example, do one person right here and get the quote.
One person that was born in 1984.
$268 a month. Now, let me just say this. All of these people are going out and getting stupid subsidies. They don't even know what they're doing to themselves. They get a subsidy. Guess what? If they make too much money, they're going to get a penalty.
Yeah.
And there's a lot of people that have gotten penalties that they weren't expecting because they say what they think their income is going to be, and it ends up being this. They get charged back big
And it's going
time.
to be worse, Clint,
And it's
because
getting worse.
Trump is watching every dollar. You used to be able to get away with a lot of this. It
Oh,
ain't
not
happening anymore.
anymore. Well, let me tell you what. How about you take some personal responsibility and say, you know what, for $268, very affordable, I'm going to cover myself, as to what Dana said, with a $2,500 personal responsibility amount. Now, if you are not married and you're still invincible and immortal, go ahead and take the 10,000. Look what the price is on the 10,000. Pull that up just a little bit, Dana, because you're blocking the 10,000. I think it's like, yeah, there we
I
go.
got
Thank
rid
you.
of Ellie. I've talked to Ellie quite a few times, you know.
So it's 130. But here's how I look at it. You have to understand how you should view this. That 268 to 130, there's not enough cost difference to justify an extra $7,500 in my mind. So do what you want. If you're invincible, pay 130 and you got catastrophic coverage. But just know you got a 10,000 spot. Plus, there's another 5,000 in a 90/10 copay that you would have. So you got 15,000 out of pocket. Now that sounds just like a buca plan when you do that. But when you take that 2,500 and put the 5,000 to it, then you're looking at 7,500 out of pocket, and that's cheaper than any buca plan on a bronze plan. A bronze plan is 8,000 out of pocket just on the deductible. Then you've got a co-insurance, so the total out of pocket at that point is over $11,000. So
and you can pick your doctor.
And you get to pick your doctor for sure. But here's in network, by the way. Well, there is no network. You can go to any doctor anywhere in the United States, any
Absolutely.
hospital anywhere in the United States. If you want to go to MD Anderson, go. If you want to go to Mayo Clinic, go. If you want to go to Cleveland Clinic, go. I don't care. If you want to go to Little Heber City, Utah, come to Heber City. I don't care. Bottom line is, it's exactly what you need for the catastrophic coverage. Now, let me go back, go up to the top, and let's just say you're married. Let's put a plus 2, or just hit 2 and get a quote. So let's say that you're now, you have no kids and you need to cover you and your spouse. Well, guess what? It's $479 a month. And understand, if that was a buca plan right there, you would be paying anywhere from $1,400 to $2,000 a month.
Keep going. And here's the sad thing, Clint. That's with the subsidy. People right now that are paying this have a subsidy. This is going to jump up to almost $2,000. My buddy's going to watch his health insurance. We started around $750 4 years ago to 9 something. We don't know what it's going to be this year.
Understand this, and we need to bring this up right now. Is a perfect time to do that. The subsidies are for over 6 million people are going away on January 1st, unless Congress goes in and re-ups these stupid subsidies. Well, I hope they don't. I mean that with all my heart, because if they do that, all we're doing is we're putting the money right in the buca's pockets, because they love that idea and they want that money to come to them. This is where, when President Trump says, let's give the money back to the citizens of the U.S. and let them decide where they want to spend their medical dollars, this is what we're talking about. Be smart. Put it in things like this, where you're going to have catastrophic coverage for those things that you need, and do the stuff that Dana brought up earlier, where you have a primary care physician at the touch of your phone, and you go in and, Doc, I need some help. Put me on a screen. We talk to him. You see him virtually. You're getting virtual care. Then not only that, you have to understand that doctors hate the bucas because they don't pay.
They don't get paid.
And there's a lot of doctors that are going to what they call direct primary care physicians, DPCs. You're going to see more and more and more of that they won't take your insurance. If you want to see a doctor, you better have something like this, because then you pay the doctor what they want to be paid, $126 a month, unlimited visits, 24/7, 365. And they have somebody that helps them with if they're on vacation, but you have that coverage. And then they'll take care of you, but they'll also tell you better have something catastrophic over the top if they can't do it. You've got to have something that's going to cover that hospital or that surgery or whatever. This is what we're talking about. This is the way healthcare is going to go, and this is the way it's going to become affordable, by the way. What Obama did in the Affordable Care Act, that I call, there's nothing affordable about the Affordable Care Act. That's really what it is. And all the penalties that business owners have to pay if they don't do exactly what they're supposed to do, all of those things can go away, and we can bring costs down to where they should be and what they really are, and instead of the inflated prices that we're currently seeing. This is important. Now let's do the last part. Go up there and hit +3, 3+. And I'm going to tell you, when you look at this,
I want to point one thing out, Clint. If I want to use this coverage, that $2,500 primary responsibility amount, I can use a little over $100 a month to buy vitamins.
I was going to do that right at the last
or
one.
Go to the gym. I mean, things that keep me healthy, which why they call it a primary. You're the primary person. Be responsible. I mean, we have been taught to be as irresponsible as you can. There's a pill for every ill. Oh, if you're fat, here, just take this Ozempic stuff. Now it's going to rip out your whole body. Okay, of course you're gonna lose weight. You're gonna be dead, and you're gonna be a dirt bag.
Okay, so So let me break in. Dana, I got great news. It's no longer just $100 a month. How about $150 a month?
$150 a month, and I get my gym membership is $50 a month, and then I can get my supplements. I'm pretty covered.
Yeah. So understand
And I
what that
usually
means.
don't get sick.
On that $2,500 personal responsibility amount, you can take $150 a month in supplements, gym membership, and apply that to that. That now means that you have a $700 personal responsibility amount left. And more importantly, we haven't even brought this up. It's per the family, not 2,500 per individual. Now, if it's individual, it's individual. But for the two, if there's two of you, it's 2,500 for the two of you, not 2,500 each.
There are a couple things. There are a couple things that people need to know. This is not a insurance plan. Okay. This is an impact health share. And this is where people are going. I have so many friends of mine that experimented with this over the last 10 years. Barbara and I have just been doing this for the last couple of years. But some people are like, well, what happens if it goes over $500,000? And that's my math. Anybody can put in what's called a minimum essential coverage plan that'll take them to infinity if something were you had something serious. Yeah. And there are some pre-existing condition things that you have to look at, but they're not real major things. This is what we do want to leave you with. Okay, you've got to watch out with you. Here we go. We're back to responsibility. I no longer smoke. I no longer vape. I feel much better. There's also a group and employer options, and there's also Medicare options. So if people are actually looking for...
Hold on. Wait. Before you go there, let's just hold on 1 second. I want you to see what the family is real quick. Do a +3.
Oh, I forgot. Didn't I do the +3?
Nope.
Get quote. I'm sorry. I apologize to you, Clint. Here we go.
Because this is really amazing. When you look at this, for your whole family, you could have one child, you could have 6 children. I don't care. But the premium or the cost sharing per the month that you would put in is $605. Now think about that. If you have family coverage in that situation with one of the bukas, you're right at $2,000 a month. That's $24,000 that you're saying to yourself, I'm already paying $24,000 for healthcare. And then on top of that, you got an $8,000 deductible. So you got $28,000. Why do you think there's medical bankruptcies in this country? What we're talking about right here is that $2,500 is for the entire family. Right. Once that's hit, it's 100% coverage. Other than the $5,000, once that's hit, it's 100% coverage. So you're not going to hit that 2 times or 3 times, depending on what the bukas want to do, depending on what your company wants to do. Because by the way, business owners, think about this. You have to offer to your employees, if you're 50 plus, you have to offer a healthcare plan. Well, offer coverage and give them a choice of this. Because once you offer it, that's all you have to do. You don't, and it's let the individual decide which way they want to do. Because here's what's happening. You may be paying for the employee their portion, but the family is getting hit with $1,100, $1,200, $1,400 a month. Well, guess what? They can't afford that. How about we bring them back and make it so it's affordable so they have catastrophic coverage? That's what we're talking about here. Now, the other things that Dana's bringing up, these are all plans that are important to us. That in this case, because it is health sharing, they can check for pre-existing conditions. If you've had cancer, you need to be treatment-free from cancer for 36 months, and then you have full coverage on. If you have type 1 diabetic, that is a pre-X, because they're going to look at you and say, well, we'll help you with things, but we're not going to put that in the community at this point because of the cost of that. If you're a type 2 diabetic and you've got it under control with medication or diet or exercise, and you're keeping your A1C at a level that's 6 or under, that's not a pre-X.
Right. And there's some different strokes for different folks, but I just wanted to bring it as we come to a close here real quick.
Do the Medicare one just real quick.
What was that?
Go to make that person born in 1959. And we're going to show you something about Medicare right here.
How many people, Clint, did we see that towards the end of our little stint of third party administration for over 20 years, drop that the employee would get the coverage, but they could not afford it for the family. So you got the employee only has coverage, they're getting on a pre-tax basis, but the rest of the family doesn't have anything because they can't afford the other $1,400.
That's right.
Here's your opportunity.
And that's 95% of all employers out. Well, I'll back that off. Let's just say it's 85% of all employers that are out there because they can't afford it. They're not going to pay the family coverage. But here's something very important. If you are 65, 66, you have Medicare Part A and Part B, you can have a $1,000 personal responsibility amount. There are no pre-existing conditions on this. That means you can come into this plan. Now, if you're on Medicaid, you can't. I'm just going to flat say that. Other than that, look at that. It's $1,000. And by the way, this is in any state, any county in the U.S., any doctor, any hospital that's billing Medicare, this is eligible. This is kind of like a supplement rather than a Medicare Advantage, if you will. So in that situation right there, you have $1,000 out of pocket as far as the personal responsibility amount and $96 per month. So if I do that right, Dana, let's just say it's $100 a month. That's $1,200 plus $1,000. That's $2,200. Well, I'm going to tell you what, if you have a Medicare supplement, you're paying anywhere from $185 to $285 a month for it. Let's say it's $250. That's $3,000. Would you rather have $2,200 or would you rather have $3,000 out of your pocket? Because if you buy a supplement, you're guaranteed that you paid $3,000. I'm just telling you.
We're just here, folks. But we just wanted to, you and I get so excited about this stuff because, I mean, we do. We can't help it. Clint and I have been working on this for the last year and a half, looking at, there's a company out there, and I'm going to give a kudos. There's a company out there called Crowd Health. They're pretty good. There's MetaShare. They're pretty good. We thought that this was the best one that was out there based on our experience. And we just wanted to make sure that people had ideas and ways to, I mean, gas is going to go down. We're going to end up with taxes. The IRS will one of these days be gone. There's a lot of things that are happening right now in this administration, and we're trying to fix healthcare. So become active, get into what's going on in your community, find out little things like this. Talk to other people if they're going, oh man, I can't afford $1,000 or $2,000 a month for my family for health care. Go talk to Dana. Okay. This is not a big money maker for us, folks. It just isn't. Okay. This is something that you can check out and get into. But I did want to go back real quick and say, the one, no matter what health care coverage you have, if you want to save a lot of money, check out Patriots on Call.
God bless you. God bless America. And please become responsible. And let's get the cost back where it should be. Dana, that would be my closing statement. And go Patriots.
And that's all we're doing, folks. I want to thank you, Clint, for taking the time. I do want to remind people to take a look at our website. Go to mtnpats.com. Sign up for our 250th anniversary. Become an actor. Learn about the history of the country. Learn how their founding fathers did it so that we didn't end up where we are now because we stopped paying attention to the Constitution and the way our Bill of Rights works. Okay, we just got lazy. We didn't pay attention. We assumed that we can ask Grok or AI or somebody's going to tell us the truth. It doesn't work that way. You've got to do your own research. And all we're trying to do is be a research engine for you and some of the things that we do. And one thing I will tell you is, and Clint will agree with me on this one, we are a John 832 company. And the reason I say that is because we want you to do your own research and you shall know the truth, and the truth shall set you free. I want to thank you, Clint, for taking the time today and meeting with me, being able to us have a great time catching up. And anybody's got any questions, make sure that you call, email, ask a question. We're not high pressure salespeople, never have been. The idea is, hey, look, if we can help you, fantastic. If we can't, we
Dana,
can
it's
we can
it's
find
all
somebody
about
who can.
education. Yeah, it's all about education. And one last thing, there's a lot of people out there that'll think about this. Wake up, America!
Wake up, America.
It's
And you know what
time.
you made me think of? When you're on our site, look up. You can find us actually at wakeupwinchester.com.
All
Clint,
right.
thank you very much, my
Wait,
brother.
one last thing, one last plug. You see the beautiful mountains behind me? I've seen the beautiful mountains on the East Coast. I
With a
love them.
chemtrail.
But you're cracking me up, dude. But understand, the mountains in the West are spectacular. I hope some of you people in the East take a look that have never been out to the West. Come out, see these beautiful mountains. We love you. God bless America and stay strong.
We'll see you again next time on Mountain Patriots Educational Ministries. Have a blessed day.